morning. I'm Carlos de Mendoza Lima. I'm actually at the moment sharing the WPA, the World Psychiatry Association section of Old Age Psychiatry, and also counselor of the European Psychiatry Association section of Old Age Psychiatry. It's my pleasure to be with you today here, and today I will talk about human rights, why they are so important for the mental health of older persons. We used to say that during the ancient times, all the empires, including the Roman Empire, have recognized the duties of people. They have published laws, rules, but never the rights of people. Maybe the first document proposing some rights was Magna Carta in England to limit the power of the king. Later, during the 17th century, philosophers started to recognize that people could have rights, not only duties. And at the French Revolution, we had the Declaration of Human Rights that serve as base for example, the United States Constitution, and all the countries in America independence from Spain and Portugal have used these principles too. And later, during the 19th centuries, the principles of human rights started to be spread everywhere. The modern human rights for us start really in 1948, when after the creation of the United Nations, all countries belonging to this organization signed the Universal Declaration of Human Rights. It's not only important to have a declaration of rights, it's important to create the means to identify, control, promote, prevent the violation of these human rights and punish the individuals and the countries and the organizations that don't respect that. Now, human rights is not only a list of things list of declarations of the principles recognizing the rights. It means a huge organization that can put this in practice. The Universal Declaration of Human Rights has 30 principles, and the common rights violation of adults are mainly the exclusion, marginalization, discrimination, the denial of employment, no access to effective mental health care, deny access to general health care, abuse, negligence, violence, the financial exploitation, arbitrary deprivation of liberty, denials of rights to marry or have a sexual life, no means to enable living in community, not respect for a spiritual life and the practice of the spiritual life, and so forth. So what is missing today is not only a clear declaration of the rights of all people, but the whole organization to prevent the violations and punish those violated these principles. In terms of mental health, we should say that the World Mental Health Report 2002 that has just been released 3 months ago insists on the fact that investing in mental health is needed to stop human rights violations. Mental health and human rights are very linked together. Around the world, people with mental health conditions are frequently excluded from the community, they are discriminated, and their basic rights are denied. And too often, they are subjected to human rights abuse or some health service. Us, as clinicians, if you pay attention, we can consider that we violate in our clinical practice sometimes the rights of these people. Putting this together, the United Nations started to think since the beginning of the 80s to give importance of the aging of population, and has created the first World Assembly on Aging in Vienna, Austria in '82. This meeting, this assembly, produced the Vienna International Plan of Action on Aging, which was the main product of this meeting. It was the first international document, instrument on aging, providing a base for the formulation of policy and programs on aging, and promoting in somewhat the human rights of aging. It was endorsed by the United Nations Assembly, and it promoted regional international cooperation, including 62 recommendations for action, addressing research, data collection, analysis, training, education, as well the following sectoral areas: health and nutrition, protection of elderly consumers, housing and environment, family, social welfare, income security, and education. After that, we had a second World Assembly. 20 years passed, and very few things were done. It was hard times. The United Nations were very involved with a lot of conflicts, and this program was delayed. And in 2002, at Madrid, we had the Second World Assembly on Aging. And here now, things become much more clear. The Madrid International Plan on Aging and the political declaration adopted of the Second World Assembly mark a turning point. The Madrid Plan offers a bold new agenda for handling the issues on aging and during the 21st century. It focuses on three priorities: old persons and development, advancing health and well-being into old age, and ensuring enable all supportive environments. This document and this assembly started to discuss the possibility to create an open-ended working group to discuss the opportunity to prepare a convention, the United Nations conventions, to protect the human rights of old people as complement of the Universal Declaration of Human Rights. Later, the United Nations High Commissioner for Human Rights in 2017 has recognized the importance of the mental health and human rights. So, at the same time that the United Nations discussed aging and importance of aging and protecting older people, the High Commissioner started to debate the importance to protect the people all people with mental health disease, mental health conditions. So the users of mental health service, person with mental health conditions, and person with psychosocial disabilities are positioned at the confluence of several vulnerabilities, such poverty, stigma, discrimination, social isolation, and segregation. And a comprehensive approach to addressing their human rights situation requires the protection of autonomy, agency, and dignity. It requires policy shifts that recognize exclusion and marginalization as the consequences of poor mental health. Consequently, in meeting their obligation to achieve the full realization of rights of persons with mental health conditions, use of mental health service and persons with psychosocial disabilities, states should align the policy and legal framework with human rights norms, develop and implement rights-based strategies and plans, and share technical expertise and other resources such as good practices and norms. As we will see, 5 years later, we are now preparing a guidance in this direction, how to protect the human rights of people with mental health conditions. The Office of High Commissioner and the WHO are working to that now about this guidance. I will talk this later. So, mental health, old age, and human rights. Stigma and discrimination against old people with mental health conditions is called mentalism, while the stigma against old people is ageism. All persons with mental disorders or mental health conditions or are being treated as such persons shall be treated with humanity, dignity, and respect of the dignity of person as recognized at 9 nations. Stigmatization of people with mental health conditions must be countered everywhere since that occurs. And there is therefore a double jeopardy for people with mental health conditions. On both issues need to be addressed in anti-stigma strategies for this age group. So a human rights framework specifically for older people with mental health conditions is still missing. This is necessary because of the special vulnerability of this population by virtue of societal ageism, stigmatization, exclusion, as well as disability and dependency, which mental health conditions can produce. So, International Psychogeriatric Association and the World Psychiatry Association have common goals as represented here. IPA is a geriatric mental health care professionals dedicated to promote, improve the mental health conditions of old people everywhere through the advancement of education, research, professional development, advocacy, health promotion, and service development. World Psychiatry Association, which is recognized by the United Nations and WHO as a partner, official partner, has a vision that a world in which people live in conditions that promote mental health and have access to mental health treatment and care that meet professionals and ethical standards, integrate public health principles, and respect human rights. So, at the WPA action plan, developing partnership for collaborative work and strengthening partnerships with mental health in other organizations is an important goal. And that's why IPA and the section of old age psychiatry from WPA are working together since the last 2 years in several projects that I will present to you. The first one was held on December 10 December 2020, the Human Rights Day. We have presented together a webinar series, a webinar concerning the human rights and mental health of old people. It was moderated by Professor Habiru, as speakers, Norma Sartorius, Israel Doron, and myself, and attendance was more than 80 persons. Shortly after, IPA and WPA prepared a statement, a common statement, a joint statement on rights of old persons with mental health conditions and psychosocial disabilities. It was published at the International Psychogeriatrics in 2001. This document was presented by Professor Habiru at the 11th session of the United Nations Open-Ended Working Group for the purpose of strengthening the protection of human rights of old people at New York meeting on March 2001, last year. After that, we have prepared also other documents, such this one, Older Women's Human Rights and Mental Health. It was published by Mira Hamilton, Carmela Spesa, Habiru, Laia Taylor, Gabriel Stoppe, and myself. This document was the IPA and WPA SOAP answer to the call for input to the 2021 thematic report on the human rights of old women. Later, we have also produced this author document, The Ageism and the State of Old People with Mental Health Conditions During the Pandemic and Beyond. It was also our answer to the call for input to the 2021 thematic report on aging and age discrimination. which the United Nations, the Office of High Commissioner for Human Rights, produced these documents. The human rights of old persons, the data gap, and the report of the independent expert on the enjoyment of all human rights for old people. It's Claudia Mahler, the author. So these documents had took into account the other three documents I have mentioned, which were our inputs. But Professor Habiru took the initiative to produce a special issue of the American Journal of Geriatric Psychiatry, which was published in October 2021 on the theme of combating ageism, mentalism, and abilism. It's time for a United Nations Convention on the Human Rights of People. So 14 articles were published in this special issue, taking into account several topics related to human rights, such as the burden, two editorials, and after what has happened with human rights during the pandemic. We have discussed the climate change, what is the good death, dying well, the end of life issues. We have talked about the dignity, mental health care, about living, house living, justice, the introduction of people in the labor market, the specificity of the problem concerning older women, oral health and a prevention model for ageism, mentalism, and abilism, the problem of sexuality, and finally suicide. Another document was published recently, so recently that it was 2 days ago that the International Psychiatry published this document, the IPA and WPA position statement on the privation of liberty of people with mental health conditions. This article produced showed that the privation of liberty concerned three situations. One is the privation of decision-making because of age and mental health conditions, the deprivation of liberty to care inside of the care settings, hospitalization, institutionalizations in nursing homes, etc., and what happens in terms of the human rights of people with mental health conditions in prisons. This document was the response to the call for input in the 2022 report of human rights of the Human Rights Council on the privation of liberty. And here are the two documents produced by Claudia Mahler, Old Persons and the Right to Adequate Housing, and Older Persons with Privilege of Liberty, which both were released during the summertime and was presented to the United Nations General Assembly this week in New York. As I talked some minutes later, the Office of High Commissioner of Human Rights and WHO are working together now on a guidance on mental health, human rights, and legislation. There is a call for input, and the WPA and IPA has sent our comments in a long discussion after having analyzed the draft of this guidance. So the document is not still published. I hope that in 2023 this guidance will be available, and we should put it in practice. So, what is the conventions and declarations on human rights? Well, how this can help us? As said, the United Nations Universal Declaration of Human Rights was signed in a specific time after the Second War, and at this moment, the world population was very little, less than 55%. But with the aging of the population, in very few years, and 70 years later, we are almost reaching 20% of the global population with more than 65 years. So at this moment, it becomes very important to analyze and to study how the human rights of this part of population is being violated or not. So after the 1948 declaration, some conventions was published, and not only the conventions published, but the organizations that will check if the convention is being respected were created. First was the Convention on the Elimination of All Forms of Discrimination Against Women. It was published in 79. The Convention on the Rights of the Child, published in 89. And the Convention on the Rights of Persons with Disability, published in 2006. And you have on the right the committee that were created to monitor the application of these conventions. The Convention on the Rights of Persons with Disability, also called CRPD, are very useful for us in mental health and has pushed a huge development in our fields, but it's not enough for old people. That's right that we need a convention on rights of older persons, and this is being debated in New York every year for the 11 years, but countries has been very resistant to create a new convention and the organism necessary to control that. That's why it's important that we all, as citizens and as organizations, make pressure in our governments to adopt the principle of this convention. So last April 2002, it was held in New York, the 12th Open and Working Group Convention meeting, and it's already planning for the next spring another meeting, and we hope that in the 13th meeting the principle of this convention be adopted. I recall you that we are in this decade is the decade of the aging, healthy aging, and there's a lot of sense to use also this period to promote the human rights of old people. I have here a list of 19 principles, priorities to support human rights of people with mental health conditions, which are the inclusion of social well-being principles in all mental health policies and programs, the equitable and universal distribution of power and resource, that is all, money is the key, parity of funding, policy and programs to reduce stigma and discrimination. Older adults should be able to advocate for their rights, to promotion of their rights, collaboration between primary care, secondary care, social care, and all those sectors of the society in order to promote the human rights, education and training, reduce social isolation, and the special protection of the older women because they face specific risks and vulnerabilities. So just to finish my presentation, recall that mental health conditions in old age kill, but violations of older adults' human rights kills too, and both together are a very potential disaster situation. I invite you all to become a member of our section of WPA. If you go to the website, you can find the sections and a section of the psychiatry. You click on join a section and you submit your expression of interest. I thank you very much, and I hope that this week will contribute to advance and progress in this field. Thank you.